ठीक है, so we'll start. Assalamu alaikum. This is Sana Javeria from final year. First of all, I welcome you all to Pandora's first ever session, and I'm happy to announce that Pandora is conducting a series of webinars on various topics like health researchers and discussion with seniors, discussion with alumni, study abroad, and many more, and especially for the students of IIMSR. So basically in tonight's session, we are going to discuss about the basics of health researchers and how to formulate a research question. And I'm grateful to Dr. Shafi sir for conducting this session. So without further delay, let's start it. And yes, if you have any question, you can drop them in the chat box. We'll discuss them after the session. So please go ahead. We can see your slide. Please go ahead.
Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi wa barakatuh. I welcome you all to this session on Introduction to Health Research and Formulation of Research Question. So in this presentation, we'll talk about the Introduction to Health Research and also how to formulate the research question, because research question is the basis for conducting any type of research. So you need to know what is research first, and then in the second part, we will see about the formulation of a research question, and that will be followed by the question and answer session. And in that you can have put up your queries and ask the questions, and we will have a discussion. I hope that this presentation will initiate the urge among you to conduct the research. The basis behind this lecture series is that our students should take interest and start conducting research. In the past, few of the students, they have conducted research. Even one student of 2015 batch, Dr. Sadaf, she has done one study among the teaching staff, cardiovascular risk factors among teaching staff of IIMSR. So such type of studies can be done, and few of you have done the studies which are sponsored by ICMR. Every year, there are 10 to 15 students who are applying for ICMR research projects, but few of them, they get selected and they complete also. So this presentation is about the health research and formulation of health research question. So coming to the medical education, this is the triad of medical education. In this, you can see there are three components. So all of you are supposed to be expert in all three dimensions. So first is the clinical expertise, which you will be getting while doing your MBBS. Then patient values and preferences. You have to respect the patient. You have to respect the values which are related to the patient. And third, which is more required nowadays, is best research evidence. So whatever you say or you perform or you do, you should have evidence based on the research which is done in the medical field. So research is very, very important. So what do you mean by research? Now, if you see the term research, re means again and search means to find out. So in research, what we do, we try to find out something new. So what is research? The art and science of asking question is the source of knowledge. So what we do in research, we first ask the question and we try to find out the answer to that question. In other terms, research means a careful, systematic study and investigation. So what we do in research, we do study. We do an investigation in some field of knowledge undertaken to establish facts or principles. So whenever you want to establish new facts or principles, then you have to do the research. So it is the discovery to rediscovery of the facts which are known or unknown. So again, research is a voyage from the known to the unknown, an effort to be closer to the truth. You need to find out what is the truth behind any event. An endeavor to discover new or collate old facts by the scientific study. Now use focus on this terminology, scientific study. In research, we are supposed to perform scientific study so that the results obtained are reliable and can be applied to the population where you have conducted the study, or in your area, in your state, or in your country, or even throughout the world. The results of your research can be generalized or applied. So it is a scientific study of a subject or by a course of critical investigation. So either we do a study or we go into the investigation of a particular field. So research is defined as the systematic collection, analysis, and interpretation of data. So these are the three main components of research. One is systematic collection of the data, then analysis of the data, and the interpretation of data. Why we do all these things? To answer a certain question or solve the problem. So it is the systematic investigation into an study, establish facts to reach new conclusions. So when you want to come to a new conclusion, you have to perform the research in the form of systematic collection of data, analysis of data, and interpretation of data so that you come to a conclusion. Now, whenever we perform research, we need research methodology. So if your methodology is correct, then your research will be reliable and valid. So what is research methodology? It is the highly intellectual human activity. So we are doing certain type of activities used in investigation of nature and matter. Deals specifically with the manner in which the data is collected, analyzed, and interpreted. If you are doing a research, you are collecting data, but if you are not doing it in a scientific way, then it is going to be a waste of time. So in that case, you need to adopt a proper research methodology. So it deals with the data collection, data analysis, and interpretation of the results. It is also an approach that helps to understand not only products of scientific inquiry, but the process itself. So the process of research is understood by research methodology. So once you plan to conduct a research, you should have idea about the research methodology. Now coming to the dimensions of health research, or you can say these are the some of the types of the health research. One is theoretical research and applied research, preventive research and therapeutic research. Bench-based research means the research which is conducted in the laboratories, and bedside research means in the clinical departments. Exploratory research, when you want to study in detail, and confirmatory research, where you have to prove that a particular factor causes the disease, like smoking causes lung cancer. Then implementation research and translational research. So these are all the various types of research which are being used in day-to-day practice. Now coming to the fundamental principles to be followed while conducting the research. So first step is the planning stage, and it is very critical. You need to spend enough time and involve the right people in planning of the research. So one man cannot do this. You need a teamwork for this type of research. So there are three levels of review before you start the research. First is scientific review. So they will check for the novelty of the research, rationality, and justification. Means the research which you are doing is novel or new or not, whether it is rationality means whether it is required or not, and the justification means the resources available for conducting research are properly utilized or not. Then ethics review, where you have to see about the human subjects protection. While conducting research, no study participant should be harmed. They should be protected. Then regulatory review, that is regarding the foreign funding, sample shipment, intellectual property, or exchange of visitors. So sponsored research, in that case, we need to go for the regulatory review. So in our college, we have the committee for scientific review and also the committee for ethical review. Process of health research: ensure that data collected systematically. You should not follow a method which is a crude method or unsystematic method, which will lead to the error in the data collection. Then draw meaningful conclusions from the results of the research. Make appropriate decisions based on your research. Take appropriate action for prevention and control of disease. Suppose you have conducted a research on cervical cancer screening and you have detected some number of cases of cervical cancer, then you need to provide treatment for them. Otherwise, this exercise will go waste. These should help in the reduction of suffering and ultimately improve the health and well-being of the community. So ultimate aim and objective of conducting any research is that you have to reduce the suffering of the community and improve the health and well-being of the community. Now coming to the breadth and depth of inquiry in health research. So human host, you can have healthy subjects or subjects which are susceptible for disease, people who are suffering from the disease, or even you can perform research on dead people also, like in forensic medicine also they do, and in anatomy department they do research on cadavers. Surrounding environment and society, you can have the research topic related to climatic factors, housing, vectors, animals, socio-cultural practices, and family structure. Healthcare infrastructure and delivery also, like suppose there is a village and you have very small one health center. So whether that health center is sufficient to cater the services or not, whether the infrastructure which is required in that center is sufficient or not, whether the health center is able to deliver the health services which are required for that village. So these are the three areas where we can go for conducting research. One is human beings, on human beings, human subjects. Second, in the surrounding environment and society. And third, for the healthcare infrastructure and delivery. Now coming to the broad scope of health research, what are the benefits or what are the areas where we can go for the research? One is getting additional or new information. Truly speaking, whenever we perform any research, it should detect or it should identify the new knowledge or new information. But mostly in India, people, they conduct research on known facts. So you need to perform the research which will yield new information or additional information. Are more like there are some questions here. Are more of diphtheria and pertussis reported among adults in recent times? So this is one of the new information. We know that diphtheria and pertussis are more common below children below 2 years of age or 5 years of age. But because of high coverage of the immunization, now there is a shift in the age of diphtheria and pertussis. So you can do research to find out whether really adults are suffering from diphtheria or pertussis. What are the differences in full genome structure of hepatitis B virus and hepatitis E virus? So this is again a new information. Verifying and confirming available information. So you have some piece of information and you want to confirm whether there is a relationship between the two factors or the information is true or not. So question related to this are etiologies of pediatric pneumonia different in the children aged 5 or less in developed and poor resource countries? Or have the incidence and complications of diabetes changed with increasing consumption of pre-cooked packed food? Nowadays, this trend has come very fast. People are eating the pre-cooked food or packaged food. So what is the effect of that on the complications of diabetes? Explaining cause and effect relationship. Does presence of a particular co-receptor cause on CD4 cells protect HIV infection effectively? So this also is one relationship that co-receptors present on CD4 cells. CD4 cells are protective for the human body, and they play a very important role in HIV infection. Are breast cancers more common in breast implant recipients? So these are all the different types of health research which can be performed. Testing new drugs, mostly clinical trials or randomized controlled trials are done for testing new drugs, vaccines, tools, or interventions for prevention, treatment, and control of a disease. So examples like here, can INH prophylaxis delay onset of tuberculosis in HIV infected persons? We know that HIV people are more prone for development of tuberculosis, the most common opportunistic infection among HIV infected people. So what they do, the people who are suffering from HIV with CD4 count less than 500 or 200, they give INH prophylaxis to them so that tuberculosis is not caused. Will introduction of smokeless stoves result in introduction of respiratory morbidity and mortality in certain areas? So this is another question which is used in testing of the new vaccines, tools, or interventions. Then evaluating ongoing programs and assessing feasibility of new programs. Like Government of India, they start national programs for a particular public health problem. So you can evaluate the program and you can decide whether the program should be continued or discontinued. Like in 1978, ICDS program was started in some districts of India, and later on they found that the grade of malnutrition is reduced, or problem of malnutrition is reduced tremendously after starting ICDS. So they started covering more and more districts, and now whole country is covered under ICDS program. Another example is the National Tuberculosis Control Program, which was named Revised National Control Tuberculosis Program, and now it is National TB Elimination Program. So like this, you can do the evaluation of the existing programs and you can decide about to start a new program. So is injectable iron sucrose a better alternative to deal with pregnancy-related anemia than oral anemia? We know that more than 50% of pregnant females in India are anemic. So you want to have a method of injectable iron sucrose compared to the oral iron. With the integrated disease surveillance program, be able predicting the epidemics of influenza and bird flu in India. So this is another program, IDSP, which keeps surveillance on the infectious diseases in our country. So is it possible for them to predict the occurrence of any epidemic of influenza or bird flu? Now, before you start your research, making the right choice of study design. First is the study question. Second, you need to choose a appropriate study design. So we have qualitative studies or quantitative studies. So when you study quantity in a study or in your search, it becomes quantitative studies. And when you assess the qualities, that becomes qualitative studies. Second group is observational studies. You just keep on watching or observing. You don't do any kind of intervention. That becomes observational studies. Or experimental, where you do some intervention or you perform an experiment and then you see the result. Retrospective studies, these are mostly done on the recorded data or stored data. So the data which we have stored in our institute or hospital, you can perform retrospective study, or you can start study today and continue it in the future. That becomes prospective studies. So these are the broad areas or study designs which you usually choose study design. Then some critical considerations in planning phase. Now, these are the few things which you need to plan before you start the research. So there should be adequate justification to conduct the research. You have to justify it why you are doing it. Then the research questions should have clarity and focus. Case definitions of study variables and outcomes. So whenever we perform study, you will come to know two terms. One are the study variables and the outcomes. So the case definition of study variables and outcomes should be standard and unambiguous. Like I'll give one example here, the example of tonsillitis. Suppose you are doing survey in the community for tonsillitis and you define it as inflammation of tonsils. But if the people of paramedical cadre are involved in data collection, they will not know what is inflammation. So you need to define or redefine, or you have to give practical definition of tonsillitis, like swelling and pain of tonsils. So it will be easy to identify the condition. Then sample and sample size. This is very crucial part of health research. If your sample size is not sufficient, then your results will not be reliable and valid. And the sample required is not up to the mark, or the sample chosen or sampling is not done in a proper way, then the study will not become scientific. So in a scientific study, you need to choose an appropriate sampling technique, and also you need to determine the sample size before you start your research. So samples should be representative of the population. So it will determine the external validity, means application of the results of your research in the general population. And it should be adequate power to draw, meaning in inferences. So samples should be sufficiently large so that you can draw the inferences from your study. Now coming to the errors which happens in a research, and these two terms, random error and systematic error, you will come to know whenever you perform research. So you need to know what do you mean by random error and what is systematic error. So random error representing wrong result due to chance. It happens by chance. Unknown sources of variation that can distort findings in either direction. So there are some chances of error because of the chance, not because of the influence of any factor. So it can be minimized by increasing sample size. So you need to have a sufficient sample size to reduce the random error. Systematic error is signifying wrong result due to bias, mostly due to variation that would distort the results in one direction. So this is because of the improper sampling technique or insufficient sample size. So it can be minimized by improving study design. You need to choose a proper study design so that there should not be any systematic error. Challenges in designing and implementation of research studies. One is co-founders, which affect both study variable as well as the outcome, and effect modifiers, which can alter the relationship between the study variable and outcome negatively. It will have a negative effect on the study variable and study outcome. Now coming to the study methods and measurements. First, you need to perform a pilot study on a small sample, and you will come to know that whether the study is feasible or not. Then study participants, inclusion and exclusion criteria need to be defined. Data collection instrument you have to develop. Measurement tools and assays. Plan for statistical analysis, what type of statistical test you are going to apply. Quality control and assurance at all levels is very important. Then focus will be that we need to improve the health situation of the community. So health research aims at finding answers or practical solutions at individual and community level. So we can perform research at individual level also and at the community level also. Now coming to the formulating research question. So whenever you plan research, you need to have your research question. So here you need to spell out research question, state research hypothesis, and formulate the objectives. So we'll see how to spell out the research question. So this is the life cycle of research. So here you need to find out what are the needs, data needs. So you need to find out why there is a need to identify the data. Then you have to prepare a research question, and then followed by study objectives. So this is the total life cycle of the research, which whenever you perform, you have to go through all these steps. So in this presentation, we'll just see about the research question. So what is research question? It is the uncertainty about something. You are not certain, you don't know about that. The investigator wants to resolve by making measurements in the study population. So uncertainty to data needs. Clear question facilitates to choose the most optimal design. So if you know your research question, you will be able to choose a appropriate study design, identify who should be included, what outcomes should be, and when the outcomes need to be measured. So it is the refining ideas into the research question, begins with general uncertainty about a health issue to narrows down to a concrete researchable issue. So like this, we develop our research question. So it frames problem in specific terms, clinical or public health, focuses on one issue. Better you include one issue in your research question. Is written in everyday language. It should be understandable. Can use more than one operational verb if required. Should link the question to the potential action that would be taken once the question is answered and is stated as a question. So whenever you write a research question, it should be in the form of a question. Research question sets out what the investigator wants to know. यानी आपको उसमें लिखना है कि आप क्या जानना चाहते हैं, क्या मालूम करना चाहते हैं. Not what the investigator might do or what the results of the study might ultimately contribute to that particular field of science. So it is the investigator who wants to know something, so he prepare a research question. So what are the preparation of the sources of the preparation of research question? First, mastering the published literature. So here what you need to do, you have to go through the journals where they publish the studies, previous studies. Then you get the ideas how to do and what to do. Attending research meetings or conferences, having a skeptical attitude about prevailing beliefs, applying new technologies to old issues, being alert to new ideas and techniques, careful observation, teaching and tenacity, keeping the imagination roaming. So you just go on imagine that what I can do, choosing a guide or mentor. So being a student or at any level, even at MBBS level or MD level, you need a mentor or you need a guide who can guide you in a right direction. So before you plan any research, try to find out the mentor and the guide. Two categories of research question. One is descriptive question and another one is analytical question. So involve observations to measure quantity. No comparison group or no interventions will be there in descriptive question. Whereas in analytical, you can do comparisons or even you can do some kind of intervention or experiment. So in analytical type of question, we usually test a hypothesis. So what is hypothesis, that we'll see in the later part. So steps in conceiving a research question. So first you need to review of the state of art information. So whatever standard published literature is there, through that you need to go, raise a question, decide worth investigating by peer review. So once you decide it, let your peers review it and give their output or remarks. Define measurable exposures and outcomes. You need to define exposure and outcome also. Sharpen the initial question, refine the question by specifying details. So that we'll see, there are some examples of the research question also. Like we'll take the example like this. Should diabetics do exercise daily? Now this is a vague type of question. Which diabetics, type 1, type 2, with complications, uncontrolled, controlled, and nothing is mentioned. Exercise, whether it is walking, jogging, or heavy exercise or brisk walking, that is also not mentioned. So you need to refine it by applying certain steps. So first step is to review of state of art information. Exercise reduces blood sugar, body fat. So this little bit you have specified. Exercise improves protection against developing diabetes related complications. So here one effect of exercise is reduction in blood sugar. Second is prevention of complications. Raise a question, can exercise help control blood sugar level? That you will raise a question, yes, really, whether it controls or not. Rather vague, need to define exercise and blood sugar level. So you put a question, can exercise help control blood sugar level or not? Decide worth investigating by peer review. So what is the level of reduction in blood sugar? How many milligrams of sugar will be reduced by doing certain type of exercise like fasting or random or postprandial blood sugar? So which blood sugar will be affected by exercise? Then what are the optimal type, frequency, intensity, and duration of exercise? And what are the risks of doing exercise and what are the other benefits of doing exercise? So you need to elaborate. Then define measurable exposures and outcomes. So here predetermined physical activity, that will be the exposure comprising of any body movement produced by skeletal muscle resulting in an increase in energy expenditure. At least one session of 60 minutes every day for 1 year. So this is about the description of the physical exercise. Could be specific whether it is walking or jogging, cycling, or any other kind of aerobic exercise. So these are all the exposures. Outcome will be the fasting blood sugar level. So fasting blood sugar level has to be reduced after doing exercise. Then refine the question by specifying details. Now you need to define what is the extent of walking practiced by diabetes, type 2 diabetes regularly. So this is a type of descriptive question. What extent of walking practiced by diabetics regularly? And second is in order to improve management of type 2 diabetes, we wish to know whether brisk walking by diabetics for at least so steps in considering a research question. So we can refine the question by specifying details. We can have the question in the form of descriptive question or it can be analytical question. So what is the extent of walking practiced by diabetics, type 2 diabetes regularly? This is a descriptive type of question. In order to improve management of type 2 diabetes, we wish to know whether brisk walking by diabetics for at least 1 hour daily reduce fasting blood sugar level as compared to those who do not do any exercise. Now coming to the final criteria, when you are going to construct the research question, you need to keep these 5 points in your mind while preparing the research question. So a research question should pass the test of FINER. This is called as FINER, FINER. So first step is the feasibility of the study. Suppose you have planned a study in your area and the study participants which are required for performing particular type of study are not available in your area. So it will be not possible to conduct the study. The study will not pass the feasibility test. So you need to find out adequate number of participants, technical expertise required, and the resources for conducting the research. Then the research question should be interesting, means it should initiate the interest among the readers of your results. So you should prepare the research question in such a way that it looks interesting, then it should be novel or new, then confirms or refutes or extends previous findings and provides new information. So research question should be novel and it should be ethical, means it is amenable to a study that ethics committee will approve. So in ethical research question, there should not be any harm caused to the study participants. And it should be relevant, like advanced scientific knowledge should be produced, improve practice and influence the policy, national policy. So this is called as final criteria, which should be applied when you develop the research question. Now coming to the statement of research hypothesis. So what do we mean by hypothesis? Hypothesis means the assumption. When you assume something, it is called as hypothesis. So it is the specific version of research question that you need to include the hypothesis, summarizes main elements of the study in your hypothesis, then establishes basis for test of statistical significance. So if you are going to test the hypothesis, you need to apply the statistical test after the research. Main elements will be the sample, exposures, and outcomes of the research question. In this research question, you need to define in which population you are going to perform the study. And if you are conducting a study on any exposure, that exposure should be mentioned. And if the exposure is defined, then what outcome it will lead at the end of the research. So you need to include the outcome also. Then stated for analytical question with comparison groups. So if you are doing analysis, then you need to include the comparison group. So you need to include the comparison group in your research question. For research question with terms, for research questions with terms greater or less than, causes, leads to, compared with, more likely than, associated with, related to, similar to, or corrected with. So these are the different terminologies which are used in a research question when you frame the research question. So purely descriptive questions do not require hypothesis. So if it is a descriptive, then you need not state the hypothesis. But if you are doing analytical type of research, then you need to mention the hypothesis in your research question. Now coming to the example of research question. So we'll continue that diabetic question. Among diabetics, type 2 diabetes, from the study area who do brisk walking for at least 1 hour daily results in an average reduction of 10 milligram% of fasting blood sugar level as compared to those who do not. Now this is a little bit descriptive type of the research question or hypothesis. So here they have mentioned about the type of exercise, for how much duration they are doing it, and how much percentage of blood sugar will be reduced after doing this kind of exercise. So this is a type of analytical question. Then characteristics of a good hypothesis. One is simple, one exposure is included, one outcome is included, and it is specific. No ambiguity about the study participants or variables. So they are clearly mentioned. Stated in advance. It is written at outset and focused on primary objective of the study. So this is called as the good hypothesis. Now coming to the formulation of the study objectives. So translating research question into objective. So once you frame the research question, you have to develop some research objectives, and that research objectives you have to study and fulfill after you complete the research. Whether your objectives are achieved or not achieved, you will come to know at the end of conducting research. So for conducting research, you need to develop some objectives. So frame in scientific or epidemiological terms, take the question in a few limited axes, write in scientific or epidemiological language. Here you need not write in a local language. It should be in the scientific language. Make use of no more than one verb for each. So you have to use one verb in one objective. Sort as primary and secondary. Primary objectives, secondary objectives. So main objectives will be primary, and some related information, additional information, if you are seeking, they will become secondary objectives. Be clear about the type of question. Descriptive question, measuring a quantity, or analytical and experimental question, testing a hypothesis. So you need to be very clear about the development of objectives which are related to descriptive and analytical question. The research question: in order to improve management of type 2 diabetes, we wish to know whether brisk walking by diabetics for at least 1 hour daily reduces fasting blood sugar level as compared to those who do not. So this is the research question. Now what will be the objective? Determine the effect of brisk walking for at least 1 hour daily on fasting blood sugar level of patients with type 2 diabetes compared those who do not. So your objective will be aligned to your research question. So you need to first develop the research question and then develop the objectives, and objectives should be aligned, means they are same as that of research question. What you want to learn from the research question, that objective should fulfill. So you need to develop the objective in such a way that it is aligned to the research question. Good and bad examples of study objectives. So determine importance of sedentary lifestyle among diabetes. So this is not a specific type of the objective. Estimate prevalence of physical activity among diabetes. Now you are measuring. Estimating means you are measuring. Then you assess physical activity and diabetic complications. Estimate the effect of physical activity on the rate of diabetic complications. So this is a specific type of or good type of study objective. Evaluate depression and diabetes. So this is again a bad type of study objective. Determine whether depression is more common among diabetics as compared to healthy individuals. So you are doing comparison here. So it is an analytical type of question. Asking yourself the right question. Then when you plan the study, two ways to deal with a poor or irrelevant research question is to try to answer it. First, the answer may be of no use of anyone, means you are conducting research, but it is not useful for anyone. There may be no answer to the question. Try to reframe it if you find this problem. If your research question is wrong, no good hard work will save your work. So if the question is wrong, then whatever work you do, nobody can save you. If your research question is right, you have an opportunity to do a good job. That's why you need to have a right research question. So this is all about the research question, formulation of research question, development of objectives, and introduction to the health research. The main reference is Introduction to Health Research. It's a book by WHO in which they have given in detail about the research methodology, how to conduct the research. That book is very useful and is available in the PDF form with me also, and in the internet also. If you search Introduction to Research by WHO, you can get it. So before we conclude, I request all of you, please go to YouTube channel and search for Dr. Shafi. You go to my YouTube channel and subscribe it. Okay. So thank you very much for this giving me chance to interact with you people and have a presentation on introduction to research and formulation of research question. I'm very thankful to the Pandora group of our college and also our college for permitting me to conduct this type of activity. Thank you. Thank you very much.
Thank you. This is a good insightful session. Can you please share the link or PDF to that book, Introduction to Research? I'll circulate it
Okay,
first,
I will do it.
and we'll wait for more fights. I think participants don't have any questions, so I think it's good to end the discussion now. Thank you for conducting the session. We'll end the meeting now.
Okay, thank you very much.